This is the video I wish had existed when I was working in conventional gastroenterology. The video I could have handed to every woman who left our clinic with an IBS diagnosis instead of a prescription for Imodium or stool softeners and no real answers. Everything I know about IBS, what causes it, how to find the cause, and what it actually takes to heal is in this video. If you watch nothing else on this channel, watch this one. In the next few minutes, I will walk you through the complete picture of IBS, from what it actually is and what drives it, through the testing that reveals the real cause to the treatment framework that takes clients from years of suffering to symptom-free in about 6 weeks. Use this as your reference point. Share it with someone who needs it. The information on IBS is vast, contradictory, and often wrong. Eat more fiber. Fiber is the problem. Take probiotics. Avoid probiotics. It's stress. It's diet. It's something you have to live with. It's parasites. The noise is overwhelming, and the actual answer keeps getting buried. Today, we cut through all of it. I'm Anelia, a board-certified PA with 11 years in gastroenterology and holistic gut health. This is not theory. This is the clinical framework I use every day, built from over a decade inside conventional medicine, and then discovering what actually works when that system falls short. The plan for this video is to give you 6 chapters. Each builds on the last. By the end, you have the complete picture and a clear sense of where you are and what to do next. Chapter 1. What IBS actually is and what it isn't. IBS is one of the most common diagnoses in gastroenterology and one of the most poorly defined. Understanding what the label actually means changes how you approach getting help. What IBS is: a functional diagnosis. The gut is not actually structurally damaged in any way, conventional testing can detect, but it is not functioning properly. It is a symptom cluster: bloating, gas, abdominal pain, diarrhea, constipation, or alternating between the two. IBS is a description of what is happening, not an explanation of why. What IBS is not: it is not a root cause diagnosis. Receiving an IBS label does not tell you what is driving the symptoms. A permanent condition. When the underlying cause is identified and treated, symptoms resolve. IBS is not evidence that nothing is wrong. A normal colonoscopy rules out structural disease, not functional dysfunction. The subtypes and what they indicate. IBS-D. This is IBS with diarrhea. Predominantly with diarrhea, people will still have cramping, sometimes bloating, sometimes upper GI issues, but predominantly their issue is diarrhea with cramping. IBS-C. That is IBS with constipation, all of the above, but with constipation. And IBS-M, which is mixed, meaning sometimes constipation or sometimes diarrhea. What drives these conditions is a variety of things. You may have the same symptoms as someone next to you, but a completely different picture on the inside. So there may be issues with digestive enzymes, whether it's stomach acid, pancreatic, or biliary function. There may be issues with bacterial overgrowth in the small or large intestine. There may be yeast. There may be abnormalities in the microbiome, so all the good stuff. You may have too many of certain good bacteria. You may not have enough. You likely have gut permeability. There probably is food sensitivity issues going on because of gut permeability. And depending on what pathogens live on the inside, your motility would be affected one way or another. So you may have pathogens, for example, hydrogen-producing bacteria in the small intestine will speed up motility, so that would contribute to IBS with diarrhea. Methane-producing bacteria in the small intestine will slow down motility, so you may have IBS with constipation. It is important to note that IBS is actually not a real diagnosis. It is a placeholder, a name for symptoms that haven't been fully investigated yet. The investigation tells you what you're actually dealing with. IBS is a starting point, not an endpoint. The next question is what actually causes it. Chapter 2, what causes IBS? The real root causes. This is the chapter most people have never been given. The causes of IBS are specific, testable, and treatable. The most common root causes I find are SIBO, small intestinal bacterial overgrowth. This is bacteria that belong in the large intestine that have migrated into the small intestine or have come through from the mouth into the stomach and then into the small intestine. Fermentation occurs in the wrong location, producing rapid gas, bloating, and altered motility, whether it's constipation or diarrhea, depending on the pathogen. SIBO is not identified through a colonoscopy or standard blood work. It is identified either through a breath test or comprehensive stool analysis, which can indicate SIBO. Dysbiosis, large intestinal bacterial imbalance. This can exist alongside SIBO or independently. It is identified through comprehensive stool analysis. Digestive enzyme insufficiency. So whether that is your pancreatic function, your biliary function, or your stomach acid, this is where digestion begins. Well, it actually begins in the mouth, but after that, once you chew your food, it goes down into the stomach. And so if there's an issue with digestion, the whole system down the line will be affected. I'll give you one example. Where the acidity in your stomach was not optimal, it will trickle down and cause issues down the line. So, for example, if you do not have enough stomach acid, and you are introduced to a pathogen, this pathogen should be killed off in the stomach if you had sufficient acidity. However, if you do not, it will pass into the small intestine. That is how you create small intestinal bacterial overgrowth. From that point on, you may have bacteria that speeds up your motility or slows down your motility depending on what type of pathogen is coming through. That will in turn also cause leaky gut and inflammation in your intestines, and then you will be left with bloating, cramping, constipation, diarrhea, or a mixture of both. But where did the problem begin? It began with your stomach acid. The same thing can happen with a deficiency in the pancreas or the biliary system. So your enzymes and your stomach acid are crucial when it comes to healing IBS. Increased intestinal permeability or leaky gut. The gut lining becomes compromised, allowing particles into the bloodstream that should not pass. This triggers immune responses showing up as food reactions, skin issues, systemic inflammation, and fatigue. Almost always present when other imbalances have been active for a significant period. And motility dysfunction. The gut is moving too fast, too slow, or inconsistently. It produces characteristic patterns of urgency followed by stillness or slow transit constipation. This is usually a consequence of other imbalances. And last, your diet. Of course, your diet is an important trigger for IBS. Now, many people think it is just their diet. So they will go down the rabbit hole of food elimination, blaming themselves, trying to figure out what can I safely eat today. Food becomes important once we actually address everything else. If you're trying to eat perfectly without addressing all of the other things that we talked about above, digestive function, microbiome, opportunistic infections, your gut permeability, you may eat the most clean diet, but you will never get anywhere. Once we address all of the imbalances, food then really matters. You can then really affect how your stool looks the next day by eating the correct food. So if you were to just go to McDonald's or drink a bottle of wine every night, whether we fix everything else in your gut or not, you're not going to have a healthy bowel movement because you're not eating healthy. But once we fix all of the imbalances, the amount of fiber then really matters. Eating clean really matters. So food is actually crucial at that point, but will not really give you results until you fix all of the imbalances. Chapter 3. Why conventional treatments fail, the honest explanation. This chapter is not about criticizing conventional medicine. It is about understanding its design so you can understand its limits. What conventional gastroenterology is built to do. It is built to identify and treat structural GI disease like cancer, inflammatory bowel disease, celiac, or diverticulitis. Now, there's a caveat to that because to truly heal things like IBD or diverticulitis after antibiotics or after initially calming down inflammation, you do still need to take a holistic, comprehensive approach. Conventional medicine is also there to rule out life-threatening conditions quickly and accurately. It's there to manage symptoms of conditions that cannot be cured. What conventional gastroenterology is not built to do is investigate functional gut disorders at the root cause level. It is not there to order or interpret functional testing like SIBO breath tests, comprehensive stool analysis, permeability markers. It is not there to build individualized protocols based on specific imbalances found on the testing. The standard IBS treatment cycle, you come in with functional gut issues, you get a colonoscopy, which is important so we can rule out all the big stuff like colon cancer. You maybe get some stool studies that are standard to rule out the big pathogens, to rule out celiac disease. You may get an endoscopy as well. maybe some scans, and then you're told nothing is wrong, and then you get the diagnosis of IBS. You then are told to take either a stool softener or a binder like Imodium. You will be given the low FODMAP diet, told to eat more fiber, and you'll be sent on your way. Sometimes, if you get lucky, you're told it's anxiety. And then maybe you're given an antidepressant. I am being sarcastic. That is not a great way to treat someone with IBS. But it is something that happens all the time. Patients then come back after a few months because nothing has changed and they're feeling exactly the same. The conventional system is not built to treat IBS. It is built to manage symptoms. There is a pill usually for every symptom, and it doesn't really treat symptoms very well either. Conventional gastroenterology is just not built to treat functional issues. It is very well built to rule out cancer, to treat cancer, to calm down inflammatory bowel disease, but it's just not the place if you're trying to fully heal IBS. In 11 years inside gastroenterology, I watched the cycle repeat with the same consistency as the seasons. A woman comes in suffering, we rule out what we know how to find, we manage what we cannot explain, she leaves without an answer. She comes back, nothing has changed. The system was not built to break that cycle. Conventional medicine wasn't designed to find these causes. So what does the right investigation actually look like? If you're recognizing your own experience in what I'm describing, hit subscribe. I put out videos every week walking through exactly how to approach IBS the right way. Now let's keep going. The next 4 chapters cover the complete healing framework from testing through the full recovery. Chapter 4, the IBS code, the testing and treatment framework that actually works. This is the framework I use with every client. It follows a specific sequence, and the sequence matters as much as the individual steps. The IBS code: evaluate, eliminate, elevate. Evaluate. The evaluate phase is to really find out where the imbalances are. So we're going to find, beginning with your digestive enzymes, stomach acid, pancreatic, and biliary function. We're then analyzing your microbiome, all the good stuff. Do you have enough of the good? Do you sometimes have too many of certain good bacteria that drives inflammation? We're then analyzing for any pathogens, parasites, worms, yeast like Candida, multiple types of yeast, bacteria, ensuring that we do the correct testing to not miss a marker, because there's many stool analysis that actually miss opportunistic infections, especially yeast. Yeast is something that you never want to miss, and yeast is very difficult to pick up. So unless you do a really specialized test for that, you may miss it, and you may not be able to treat someone correctly when you miss yeast. Yeast does not shed in every part of the stool, and sometimes doesn't even shed into every stool. It also dies when it sees air. So you need to make sure that you're testing with the right lab so you're not missing it. Then we're looking at leaky gut and gut permeability markers. We're evaluating for any food sensitivity through the correct testing as well. Most food sensitivity tests are not accurate. They're about 50% inaccurate, which is a horrible statistic. Making sure that you are using a test that checks for multiple modes of immune response pathways in order to get an accurate result. Step number 2 is the eliminate phase. This is where we eliminate everything that is bad that should not be in the system. So eliminating any of the pathogens, eliminating gut permeability, eliminating food sensitivities that are there, and this is done for a short amount of time as we heal. And the final step is to elevate, rebuild, restore, sustain. Gut lining repair, specific nutrients supporting tight junction integrity and mucosal healing, microbiome restoration, reintroducing beneficial bacteria and dietary diversity in sequence, digestive support, ensuring enzyme and acid production is adequate long-term, systematic food reintroduction, expanding the diet progressively toward full diversity. Every client who has followed this framework in sequence has seen results. Not because it's magic, because it addresses actual causes in the right order with the right tools. My client Leanne was symptom-free by week 3. Karina had full dietary freedom within 4 weeks. The timeline is consistent when the protocol is right. The framework works when the sequence is followed. The next chapter addresses one of the most misused tools in IBS management. Chapter 5, diet, what actually helps, what hurts, and how to use food elimination correctly. Diet is not the cause of IBS, but it is a powerful tool when used with the right understanding. What helps across all phases? Warm cooked foods over raw during active imbalance, lower digestive burden. Dietary diversity as a long-term goal. The microbiome requires a wide range of plant foods. Adequate hydration between meals supports motility and mucosal integrity. Note that drinking a lot of fluids during your meals will dilute your stomach acid further and delay digestion. So make sure you drink most of your liquids between meals. Regular meal timing supports circadian gut function and the migrating motor complex. What hurts during active imbalance? High fermentable foods fed to an overgrown gut before treatment. Fermented foods and high-starch diet when SIBO or yeast are present. Extreme elimination without a treatment protocol running alongside. Elimination diets, how to use them correctly. First of all, an elimination diet is only used when you actually have food sensitivity testing, the accurate food sensitivity testing as mentioned above. If you blindly just start to eliminate large groups of foods, especially when you do that for a long term, that will actually hurt your gut more than help because the microbiome thrives on a variety of plant foods. So if you eliminate large groups of foods for a long time, you're going to limit your microbiome further. That in turn will cause more leaky gut, and more leaky gut causes more food sensitivities. So you end up with a very short list of safe foods if you do that long term. Additionally, doing an elimination diet without food sensitivity testing is pretty impossible to do because food reactions can happen within 72 hours after eating a food. So how do you accurately really test so many foods without having the actual testing done? So having a good food sensitivity test is really helpful. Additionally, a food sensitivity test is only done so you can eliminate those foods for a short amount of time to allow the immune system of the gut to calm down so your healing protocol would work. It is not the thing that gets you to heal. It is just the thing to calm the immune system down. And then all of the things you do to support the gut, to eliminate pathogens, improve the microbiome, improve digestion, can work faster for you. Once you go through a healing protocol, you then put everything back in one at a time in a guided fashion, usually every 3 days. You watch for reactions. If no reactions occur, you put the next food in. But you never just eliminate something forever. Unless you have celiac disease, then you absolutely need to stay away from gluten forever. Or you have lactose intolerance, then that is a lack of an enzyme. You have to eliminate it or use a supplement in order to eat dairy. Everything else should be able to come back into the diet if you truly healed. Diet is a tool in the protocol, not the protocol itself. The next chapter will explain to you how to get started. Chapter 6, how to get started, your specific next steps. This chapter turns everything in this video from information into action. If you haven't had any functional testing done, find a functional medicine practitioner who works with comprehensive stool analysis tests regularly, not a standard stool culture. Request food sensitivity testing. Please note they're not all created equal, as I explained earlier. Do not start new eradication supplements or dietary protocols while waiting for results. If you've had some testing but not a complete panel, identify what is missing based on the sequence in Chapter 4. Bring existing results to a practitioner who can interpret them in the context of functional gut health. If you've been diagnosed with SIBO or dysbiosis but haven't seen results, evaluate whether the protocol was individualized to your specific variant. Evaluate whether the sequence was followed. Consider whether the cause of SIBO was addressed. If you're not sure where you are in this process, start with the self-assessment from the SIBO versus IBS video on this channel. Track your symptom timing. When bloating occurs relative to meals, energy after eating, and whether skin issues correlate with gut flares. The pattern points towards where the investigation should start. A test for tonight. Write down the most specific description of your symptom pattern you can. Not just I have IBS, but when symptoms occur, what they feel like, what makes them better or worse, what has and hasn't worked. This is not for anyone else. It's to give you clarity on exactly where you are. The clearer the picture, the faster the right investigation can begin. IBS is not a life sentence. It is not a mystery. It is not evidence that you are broken or that your body has failed you. is a set of symptoms driven by identifiable causes that respond to the right treatment when someone knows how to look for the imbalances and build a protocol around what they find. I have watched this happen with client after client. Women who spent years suffering, who were told to manage and accept, who found their way to the right investigation and came out on the other side with their lives back. The outcome is available to you, not because healing is easy, because healing is possible. And now you know exactly what it takes. If you want to see what I actually do every single day to support my own gut, the specific habits I live by and recommend to every client, I made a video walking through all 7 of them. No generic wellness advice, just what I actually do and why. That's the one to watch next, linked in the description and on your screen now.